So what we'll do this afternoon is we'll spend a little bit more time on the counseling intervention, and then we'll spend some time on the collaborative problem-solving intervention, and then we'll do some behavior management strategies. And the reason for this particular order of things is given the complexity of these students that we're talking about, a lot of these children are going to have long-standing or years-long challenges, and one of the pieces that we have to have in place first is the counseling aspect, so that they start to understand what a secure relationship can be like with an adult. And also counseling is a skill-building process, so that they learn to build some skills. The collaborative piece, it starts to involve the teachers in addition to the counseling component. And then the behavior management piece focuses on structure, routine, school climate, boundaries, limits. But we need to have the foundation that comes from the counseling before we can get good traction with the limits and boundary setting and delivering rewards and consequences. With that in mind, all of these things can be happening simultaneously. So I'm not, the point isn't you have to do counseling for 6 months before you can do the next part. I do think we need to get some behavioral systems in place early. We just have to have a frame of reference of the behavior systems will start to work better once some of the skills are learned in counseling. We need to have them in place because they do offer routine and limit setting and boundaries and start to reprioritize. But the caution is behavioral strategies aren't going to work as quickly or as, I guess as quickly is the best way to put it, for these children as they do for children who have behavioral difficulties but have a secure attachment. Okay, is that, you see what I mean there? So we need to have them, but we have to be more patient with them. Okay. And just in general, we have to be more patient with these children and with ourselves in our work with these children. These aren't students who are going to benefit from short-term counseling or from brief interventions or brief therapy that we talk about sometimes. These are going to be years long in counseling. And that's okay. All right. So just to recap quickly, the deficits that we're addressing in the mentalization-based counseling is the difficulty with reflecting, reading minds, and understanding the reasons behind things. One point that I want to make here is that under the unable to consider why teachers or peers have certain expectations. One of the things to recognize with these students is they do habitually expect that the teacher or the classmates can't be trusted as being completely genuine or sincere. They anticipate that the world is not going to treat them well. So we just have to keep that in mind. And we have to not take it personally when they approach us that way, which they sometimes will, right? They're not doing it because they don't want to have a relationship with us. One of the things that we will frequently say about these students because of this fixed attribution that they make is that they're resistant to therapy. And yes, they are resistant, they are rigid, but we can still help them. We just have to be patient and take our time and so forth. Okay. We have to help them to adapt. So this difficulty adapting and this lack of trust forces us many times, and this is one of the, this ties into talking about the teachers want to let us know what went wrong and want to let us know what the child didn't do. With these students, what we're finding initially that we have to do is we have to adapt the environment to the student rather than expecting the student to adapt to the environment, right? And most young people are really good at adapting to the expectations in the environment. And then, like, you think when students get to 5th and 6th grade, they go to 3 or 4 different teachers sometimes. And when they get to middle school, they have 6 or 7 different teachers, and all those teachers are doing things a little bit differently. And even if you think about with elementary students, every 10 months, they have to adjust to a brand new adult who stands at the front of the room and tells them what to do. Imagine if every 10 months you had a new boss or supervisor that you had to adjust to. Right? None of us would like that, but we take really little people and we say, okay, you've gotten a really good relationship with this adult who you've learned cares about you and you can trust, and now you're going to be separated from that person for 3 months, and when you return to this place, you're going to have a brand new adult who you're going to have to form a brand new relationship with. And when 10 months passes, we're taking that person away from you too. Probably the best situation, but that's the reality of things. And most young people adapt to that. But these students that we're talking about today don't adapt to much too easily. So we have to teach them adaptation skills. Until that point, we're going to spend a lot of time adapting to them. And that's why we, I shouldn't say aren't interested. That's why we put less value, appropriately less value in hearing the details of the story from the teacher. Because in schools, the teachers typically want the children to adapt to the program, and these children have a tough time with that. We have to adapt to them, and that's a change. That's why some students need self-contained programs. The key piece of a self-contained program is it adapts to the student rather than the student adapting to the program initially. Then you get to a equilibrium, a balance of that. Okay. One of the things I didn't mention earlier, and I should mention, is this idea of playing by the rules. Some young people decide that playing by the rules of what it's like to be a good kid, broadly, as they would consider it, hasn't worked out for them. And so they make a conscious choice to not really value the rules. Or it's not a priority for them to play by the rules. And I've noticed that most prominently with teenage boys whose parents got divorced, and they had a notable separation of contact with their fathers. A lot of boys were really struggling with that, and carry this resentment and disappointment, where in counseling and talking with them, it would come out of, they struggled with this loss, and they were grieving the loss of this relationship, and they had done everything they were supposed to, and this is how it turned out. So why should they follow the rules in school? Pretty interesting to hear teenage boys be able to express that. And then some went to more extremes and started engaging in risky behavior, alcohol and drug use and those kinds of things. They're getting in lots of fights. And that's really what it came back to, this idea of, why should I follow the rules when this is what happened? And then I haven't read any research on this, but I wonder if that's what we see sometimes with elementary age students who have a difficult time. Okay. All right. So, broadly, the mentalization-based counseling, the key piece that we want to focus on is it rebuilds or replaces the secure attachment relationship that the student hasn't experienced before. And we know that has to be developed for a young person who's struggling. And I say we know that because there have been some large-scale studies done. Part of it goes along with the ACEs work, and part of it goes along with a large-scale longitudinal study out of Minnesota that was done in the late 80s and early 90s, looking at risk and resiliency. And the key resiliency factor that is most protective for a young person, protective in the sense of reducing risk and building resiliency, is a positive, strong relationship with one adult. And that's been replicated. That's something that we know. And it doesn't matter who that adult is, it just has to be secure and consistent. An ideal place for that is counseling. And counseling that focuses on creating this secure attachment that can help the student get a good understanding of themselves as an independent person and also help them develop the interpersonal skills that they need. The tie-in with cognitive behavioral therapy is what we want to do is adjust the schemas that people have in place. So remember, when learning about cognitive behavioral therapy, we learned about the schemas or the scripts that people bring to situations. We want to adjust the scripts or the schemas that these young people are bringing to situations. Okay. So we want them to have this sense of agency, that they're the, as I mentioned earlier, now we want them to see that, okay, you can control the direction of your life. You're not just at the mercy of what happens around you, and you can develop these interpersonal relationships. So let's talk about some strategies that are part of implementing the mentalized-based approach. So the early stages of treatment are going to be focused on the statements. There's some differences between the statements here. I'm curious to have you point out what the differences are, but in early stages of treatment, we say things like, I see that you do not like having to wait your turn. And then later, we start to identify more detail about that. I can tell you felt frustrated when he took too long with the crayons, right? So there's some important and significant differences that go about the development of this approach with young people. And then the second example is, stop, it's not safe and I need to keep you safe, compared to stop, the other students are scared when you do that, right? So if you think about those comparisons between early and later stages, just as one example, what are the differences here between these two approaches?
In the later one, like initially you're just keeping it focused on them and your relationship with them, as opposed to expecting them to be empathetic and understand another person's perspective.
Okay, that's a key piece. What else?
Emotional language.
Yeah, in the later phase, the emotional language, right? The first stage, we're leaving the emotional piece out of it. And why is that an important difference between the two? Why do we leave the emotional piece out of the early stage and then add it in the later stage?
They don't have a good sense of it yet.
They don't have a good sense of it. And so why is that problematic if we say it and they don't have a sense of it?
They won't understand. They can create another barrier.
Yeah, and they won't understand, but they'll also have the impression that we don't understand them, right? And we really want that first stage to be this sense, and if we think about what happens in a secure attachment, we want the young person to realize, oh, this person knows what's happening. This person sees what's happening. So that's an important piece. What else do you notice?
And it's focused on the first R, reflection, which is kind of that awareness.
Right.
And the later stages are more into
Yeah, a deeper understanding. Right. How about the second set of bullets there? What's different? Here's a clue. It's the second bullet is focused on responsibility.
Social reasoning of the impact of his or her behavior.
Yeah, so what's the difference between the two bullets? The second one, we talk about the impact of the student's behavior. What's the difference where the responsibility lies in these two?
And then we're taking the responsibility in the first one. I need to keep you safe.
Right.
The second one, you're putting the responsibility on that.
Right. Okay, so the first stage of treatment is I'm the adult and I'm here to make sure your needs are met. It's my responsibility to make sure your needs are met. And I will follow through on that responsibility. Okay, so that's the message we're sending to the student in counseling. And if you think about what happens, what we talked about this morning, and we spent a good deal of time discussing what happens in secure attachment. The reason I wanted to spend that time with you is in the counseling relationship, we want to recreate that, right? And it's hard to, well, it's not hard. We have to be deliberate in that effort because we're not looking at a 18-month-old sitting in front of us. We're looking at a 7-year-old sitting in front of us. But we have to send the message to the 7-year-old that's similar to what we would have sent to a 2-year-old if they have been securely attached. So the first sense that we want to take is I'm going to be responsible for meeting your needs. I'm going to be responsible for making sure you're safe, offering you security, setting limits. No matter how disruptive you are, I'm going to keep doing that for you, right? And I'm going to point out what my role is. I'm not going to point out what I expect from you. You're too overwhelmed for me to have expectations of you. Okay? Well, I need you to know what I'm doing and why I'm doing it. Right? And it's not because I'm mad at you. It's not because you're bothersome. It's not because you're trouble. You know, those kinds of things. What do you think about the value of that message being made explicitly to young people? And when I say young people, I mean, 7-year-olds and 15-year-olds. As an example, that boy who I followed down out of the building from the alternative high school, the message I was sending him is, I'm going to keep you safe because I care about you. Not, I'm going to keep you safe so I don't lose my job. Said explicitly. I left that out this morning. I did say to him, I found you because I care about you. I don't want anything bad to happen to you. I want to make sure you're safe.
Rewriting the expectations that they have of others, absolutely changing that.
Right. Well, do you think it makes an impact? It's a slow impact, right? It takes some time. And since there's this epistemic vigilance, what will children and teenagers do when they start to realize, oh, this person does care about me, this person will keep me secure? What will they start to do? Trust. Yeah, what else?
Seek you out rather than you responding or reacting to them.
Yep. There's also a negative side
They
effect.
might act out first, right, to see if it's really there.
Yeah, they'll start testing. And the reason it's important to point that out is we have to be ready for it and not have our feelings hurt when it takes place. So, as I said earlier, countertransference is a real thing, right? So the student will act in ways to test the legitimacy of this relationship that we're offering. And when it happens, we have to be careful not to think, I'm doing a bad job, I'm no good at this, I can't believe they let me be a social worker, I can't believe they let me be a school psychologist. How could anyone trust me to do this? This kid is falling apart. I mean, that will happen. This is a very humbling career, right? When it happens, remember, oh, this is what is likely to happen because of the history. Even though we've made good progress, there's still the history, and there's going to be a test, and I have to be able to navigate that. Okay. So, for instance, I'll just give you a quick example. I had worked a long time with this high school girl who had been seriously abused as a young person, had never disclosed it until she hit puberty. And she used to come to my office in the high school, and she'd be late for class because she had been smoking in the bathroom. This is when they used to smoke still. And she'd come to my office and ask me for a pass to class because she was going to be late, and this teacher wouldn't let her go to class. And I would say, I could smell that you've been smoking. I'm not going to write you past the class because you smoked instead of getting to class on time. Go to class and see what the teacher says. And I remember this distinctly because it was so hurtful to me. And she said, you're supposed to be helping me. You're not helping me. Now I'm going to be late to class. I'm going to get detention. And how is that going to be helpful for me to have detention? You know what? You're just an asshole. And I was like, oh. And well, I knew that this would happen. I didn't know about this form of treatment yet, but I knew this would happen. And I said to her, look, that is really insulting when you call me an asshole. And, you know, I'm trying to help you, but I'm not going to help you break the rules. If you want to get better at not getting caught smoking, I could tell you the places teachers are least likely to look for smokers. I will offer you that, but I'm not going to write you a pass for being late to class. You should have planned your smoking schedule better. And she's like, oh my God, you are such an asshole, after I offered her that. And then I said to her, look, you can think that I'm an asshole, but it would be much better for us if you didn't say it out loud. Because sometimes I think you're an asshole and I don't say it out loud to you. And that's what people do if we're going to maintain this. And she did just what you did. She burst out laughing. And she's like, you're right. I'm sorry, Mr. Brown. And I said, well, okay, but you know, I'm not going to write you a pass. Now go to class. And she did. And she suffered the consequences, and there was no damage to the work together. But it was good. The good thing that came out of it is she stopped calling me names when she disagreed with my approach. But that's really good, right? That's a good approach to diffusing that difficulty that we know is going to come up. Because you know, sometimes you can make light of things with people to diffuse the tension, which is what was happening there. And help people to see that what they say does have an impact on others, and also understand the intentions of the other person. So that's really good skill building in a situation like that. Okay. So then in the second bullet, second set of bullets, what we move to is from I'm being responsible for you to, oh, look, now you need to start understanding that your actions have impact on others, and this is the impact. Right. Now, what do you think would be the third column that we would start to work on? Let's take the second set of bullets. So first, stop, it's not safe, I need to keep you safe. Stop, the other students are scared when you do that. Okay, so they start to understand that. What do we want them to understand next?
Help them identify how they felt.
Oh, nope. We could start. We would definitely start talking about how did you feel in that situation. I'm thinking more in relation to the interpersonal piece, right? So, because interpersonally, the students are scared when you do that. Kayla? Yes, that would go more along with the internal feeling, interpersonally.
Like what they could do to rebuild the relationship.
Yes, that's actually the fourth part. So you're one step ahead.
We're almost there.
There's something in between. The other students are scared when you do that.
Lying and
Then
knowing.
they won't. Then they won't want to hang out with you.
Yes. If you continue to do things that scare the other kids, how are the other kids going to react to you? However we say that in a developmentally appropriate way, right? And so now we're seeing that, getting back to the basic principles, we're helping the students see you can author the narrative of your life here, right? The narrative can be, again, developmentally appropriate language, but the narrative can be you're the scary kid who people don't want to do things with, or the narrative can be you're the kid who is friendly and helpful and kind. So let's figure out which one you want to be, right? Is that clear? And then the what did you? I'm sorry, I don't know your name. What did you say that I said was the fourth piece, Beth?
Rebuilding.
Oh, right. And so, thank you. And every once in a while, though, we do have a conflict with a classmate. When that happens, we can repair it. So if everyone makes mistakes, and a big part of this, which I mentioned very briefly, maybe without notice in the morning, is this is a process of second chances, right? So we're broadly giving these young people a second chance to form secure attachments and see themselves as a coherent self and an agent and have good interpersonal relationships. Moment to moment, mistakes will happen, and we need a second chance to fix those too. Right? And that's what happens in a secure attachment, right? A 3-year-old has a conflict with her mother. A 3-year-old has a conflict with his father. In a secure attachment, the mother doesn't give the 3-year-old a cold shoulder for a week and make him suffer for the saying, "I hate you, mommy," right? It's repaired moments later in most cases, right? Or not. And if it's not repaired, then the child has a schema, a script, an understanding that it won't be. We need to redo that, right? Second chances is a big focus of this. Okay. All right. Questions about this? Do you see why the differences in the stages are important here? Okay. The other piece about this is this isn't a type of treatment that's a manual or a cookbook of you say this, you do this, this comes next. This is a dynamic system where there's this interplay and this give and take, and we're picking up on the signals of the other. Okay. So let's talk about the here and now and focusing on this. Let's for this one, let's start with the quote at the bottom. Can you guys read that? Shall I read it out loud? What we hope to achieve is a state of being with the student in the present so that he or she can eventually bear to be himself or herself with himself or herself, right? So, why is this important? You've probably observed, as I have observed, frequently when these elementary age students are being explosive and we're trying to help them calm down, they will say things like, "I hate myself, I hate my life, everything sucks, you suck, my parents suck," and even to the point of hitting themselves in the head, banging their heads on the floor. Have you guys experienced this? Okay. That is not being able to bear being with himself or herself, right? Because of the insecure attachment, the small t trauma, as we mentioned earlier. With older adolescents, it's not as readily observable, but we see intentional self-harm. We see risky behavior in the terms of alcohol abuse, drug abuse, promiscuous sexual activity, other kinds of things indicating that they can't bear being with themselves, right? Or suicidal ideation, is more obvious. So we want to be present with students in the moment to help them to tolerate being present with themselves in the moment, right? And we want to, even in difficult moments, we want that to happen in the counseling session so that it can be a teaching experience and a skill-building experience. Okay. And so it's important to point that out. What do you find frequently happens in a counseling session if the student has had a week of cutting class and getting followed around the building by hall monitors and getting in trouble? What's the focus of the counseling session? Or has been being a real nudge on the playground, and after every recess, 3 kids are complaining about your student and how he behaved on the playground during recess. What's the focus of your counseling session?
On the past, not necessarily the here and now.
Yeah. Okay. Why aren't you going to class? Why do you keep on? We've talked about this. You're not. You need to get to class. Did you see your grades? Do you know what your grades look like? This is my counseling sessions from the past. Right? I've done all of these things. And the student will say, I know, I need to get to class. You're right. I know, Mr. Brown. Yep, I got to get to class. Okay, I'm going to get to class. And then the next period, you're walking to a meeting and you see your student sitting outside the assistant principal's office. And you say, why are you out here? And the student says, I didn't go to class. And you think, I'm a brilliant, brilliant counselor. We can spend a little bit of time on what the expectation is. I think we have to spend more time on what's happening in the here and now. Now, one of the things I find when trying to do this is students don't like to talk about the here and now. They like to talk about the stories and other things that have happened, and they like to blame other people and that type of thing. So it has to be really deliberate work. So this is an example of a student I've recently been working with. So the first couple of sessions went pretty well. We were getting to know each other and building rapport, and he was putting his best foot forward and so forth. And I suspected that there was some I suspect that there's some trauma in his background. Not so much a tremendously insecure attachment, but some lack of responsiveness that he's misinterpreted a bit, let's just say. So I don't think it's too severe. But as I started to talk to him about this conflict that's been going on with his parents, he took out his phone and started to play a game. And he wouldn't stop. And I've never had that happen before. This was a brand new experience for me. Have any of you had that? Okay, good. I don't feel so alone now. Thank you. I wasn't sure what to do, but here's how I approached it. I decided not to say anything to him about it because I wanted to see how long it would go on for. I thought eventually he'll be uncomfortable if I don't say anything. and he'll realize, oh, this is, he knows better, and that he'll put the phone away. And he didn't. And it continued and continued. And it went on for 15 minutes. And occasionally he would look up at me, and I just had a blank look on my face. I was trying not to give any feedback. And then after 15 minutes, the next time he looked up, I said to him, "You have me completely stumped." And I said, "That doesn't usually happen." And so I said to him, "What's going on in here right now?" And so really, without question, directed it into the moment of not asking anything else other than, what's happening here? What's going on right now? And what do you think his response was? Nothing. He's like, what? Nothing. And of course, right, 14 years old. And with a smirk. What? Nothing. So I directed it right back to him. I said, no, there's something going on here right now. And I said, we need to figure that out together. And he said, I don't know what you're talking about. So I said, okay, that's understandable. I've done this a lot more than you have. So let me explain it to you. He said, I have been doing this for 30 years, and I have never, ever in 30 years had someone take out their phone, start playing a game, and continue to do it nonstop while I sat across the room looking at them. And so that's why I'm trying to figure out what's going on here, because it's never happened before. And he said, oh. And he said, what's going on is I don't want to talk to you today. And I said, oh, okay, you could have told me that. Right? That would have been a lot easier, because I didn't know what was happening. It's brand new for me. And said, well, thank you for telling me that you didn't want to talk to me. And I said, we've talked a lot the last 3 times you've been here. I don't understand why you don't want to talk today. Did I do something that bothered you? I think I must have, because you've talked the other times, but today you're not. And if you tell me what I did that bothered you, I'll let you know if I can change that. Now, that was not what he was expecting. Right? Why wasn't he expecting that? It's good to break away from the expected negative schema or unpleasant schema, right? Well, let's start with, what was he expecting me to do when he took, and say what? Say, tell him to put the phone away, be angry, frustrated, whatever. No, I can't be dishonest with you. I'm sure there was a little hint of frustration as I was talking with them, but it wasn't jumping up and down frustration. Okay, so he expected me to say, put away the phone. And what's the message that I send if I say, hey, look, you can't have your phone out in here. That's really disrespectful. Put the phone away. What's the perception? What's the interpretation of the message?
You're directing the session.
Oh, yes, I'm directing. Well, I think that's okay.
Okay.
But there's another, what's the message he receives about him as an individual?
He's not in control.
Yes. Well, actually, no. He is in control, because, why do I say that? That's a good point. He is, I don't think that would be the impression. I think his impression would be, aha, I'm in control. I've got him frustrated. I've got him irritated. I knew this is what he would do. So that would be the outcome he expected. So what's the impression he has about himself if I take the approach of, I must have done something, or I'm sorry, if I take the approach, put the phone away, you're not allowed to do that.
He has done something wrong.
Yes.
You flipped it and said,
So what's,
I done something wrong.
so what's his impression of himself?
Not good.
Not good.
He doesn't make good
fix it in?
Yeah, broadly, he's bad, right? Go.
Well, and I was just going to say, along with that, part of this was because we were starting to talk about this conflict.
Mm.
So for me, I would think, if I were an adolescent, like, you're not allowing me to have, like, space to really process how I'm feeling. You're forcing me to talk about it right now.
Right. So good. We're going to have to come back to that. So when I forget, you remember what you just said. The piece that we want to avoid here is making a value judgment and putting the responsibility on him as making this go badly. So I focus on what did I do, because things are different now in here than how things were in here the last 3 sessions. So let's compare what's happening in here now compared to what happened in here before, and let's figure it out. And I'm taking all the responsibility. Right? I must have done something differently because you're doing something differently. We don't like this. I don't like it. I could tell he didn't like it either, but he wasn't going to admit that. But something's not right here. So I must have done something wrong. Tell me what it is. We can fix it. We can have a second chance. Right? So he says, I don't want to talk about that thing with my parents. Okay. Great. We don't have to talk about that. But you know what? Let's think about this. It would be so much better for both of us if I bring up something and you don't want to talk about it, if you just say, Chris, I don't want to talk about that today. And maybe I'll ask you to explain why. And then you could say, I don't want to explain why. And then we'll do something else. But your time here is important. And I want to make sure I'm not doing something to waste your time when you come here. I know there are other things you could be doing, so I want to make sure your time here is time that's good for you. So can we agree to that? Sure, he says. We can agree to that. Okay, great. Now put your phone away. Okay. And he put his phone away. Right? Good outcome, because we were focused on the here and now, and it wasn't telling him how do I want to put this? It wasn't telling him what was wrong with him that was making things hard for me. It was me telling him, something's not right. How can I make it better for you? And that's a really important difference for what usually happens in the life of a 14-year-old, I think. Right? Or an 8-year-old. Right? Questions about that, or wondering why would you do that, or what if this happened, or anything along those lines?
No, I think it can be very powerful, and even in non-trauma setting. I just yesterday had some kids rolling around on walls, not really listening, and so I was working on perspective taking and kind of threw at them. Okay, so you guys are talking. Does that make you bad? They're like, yes. I'm like, no. We have different agendas right now. I'm trying to teach, and you're trying to socialize. And so we could look at it that way. But it was amazing how many times it took me to get them to say that they're not, because they're so used to
Yeah.
And not that that's not appropriate sometimes. I get calculating so many things, but that's a perfect example where you flip that script to say, hey.
Yeah, and that's a good point to make. In this situation, this is a scheduling counseling session. Right? There's no crisis to avert. There's no urgency of trying to get something to stop that must happen. Nothing bad's going to happen if he stayed on his phone for 45 minutes. I was just getting bored at 15, so I figured that was long enough. But there was no real intensity to it. Is anyone wondering what we did the next session?
What did you do next?
Thanks, Ryan. I thought this was really interesting. The next session, I took out the TAT cards and wanted to do the TAT with him because I wanted to see if he could express emotions and feelings and see cause and effect in social situations, because he was so shut down around talking about what I thought was a simple conflict with his parents. It wasn't a big to-do. So I presented him with the TAT. Some of you aren't psychologists, right? Okay. So the TAT it's a thematic perception test, and it's these black and white drawings or pictures. And the task is you show the person, child or adult, the picture, and you say, I want you to make up a story about the picture. Tell me what happened before this. Tell me what happens after it. And tell me what the people are thinking or feeling. Okay. And there's no right or wrong answer. It's just whatever the person gives. It's a relatively easy task. Most people come up with a story. Sometimes they need a prompt of, tell me what happened before. If they leave that out, they just focus on the moment. Or how does it end? And sometimes, remember, tell me what they were thinking and feeling. And people just do it. This boy could not give me a response. And he kept looking at it. And I said to him, there's no right or wrong answer, whatever you want. And he said, okay. And he kept looking at it. And he said, I can't come up with anything. And he wasn't being, you know how you could tell what's happening in the room if they're just being obstinate? He wasn't. Like, I could tell he was trying. And he said, how am I supposed to know what they're thinking or feeling? And I said, well, like you couldn't know beforehand, like you've never seen this picture before. You could make up whatever you want. So, just make up what they're doing and what they're thinking or feeling. And he goes, oh, okay. He looks and he says, I can't do it. He says, I can't come up with anything. So I said, oh, okay. You know what? Some other people think that card is kind of tricky too. Let me show you another one. Don't worry about that one. Show him another one. Same exact thing. So now I'm becoming more concerned that he doesn't have the ability to read minds or to understand intentions and attitudes and to think through things when there are other people involved. So now I'm becoming a little bit more concerned with him. I did not anticipate that was going to be the answer or the outcome of that interaction, but it was good to have done. Right? So then the next 3 sessions we played games together. And we did some storytelling games that were lighthearted. We did some strategy games. I just had to really change the dimension of what counseling meant to him. Because again, like the first couple of sessions were rapport building and like getting to know you and that type of stuff, and it was all easy. Yes?
Now, going back to what I was saying before, and probably in that moment, hard for him to even do that, which is why he chose to say it. In his words, I'm not doing this.
Right.
It was complaining.
Yeah. And then the discussion about the conflict with his parents that I wanted to pursue was going to be talking about how did, there was just going to be this sense of how did you feel, blah, blah, all that stuff. Okay. Any thoughts or questions about that interaction, that case? Okay. Do you want to know how it's going? It's been tough going. I did start seeing him with his parents because we were just too superficial, him and I together. So I switched it to family. And his approach with his parents in the room was to be very dismissive of their feelings and emotions, like hurtfully dismissive, saying things like, I don't care what it's like for you. It doesn't matter to me what you think, and those kinds of things. And so the approach with him was to let him know how hurtful it was for him to give that message to his parents, and that his parents, I worked with his parents to be very reassuring. It's hurtful that you say this, but we still care about you. We still love you. We will still do what you need. We would like it if you were more thoughtful about how what you say impacts us. So there was even at one point where he was so dismissive and hurtful towards his parents, to set a limit, I said to him, you know what, you're going to have to go and wait in the waiting room right now. I'm going to talk with your parents, but it's very troubling to hear you talk to your parents this way, and I'm not going to tolerate it in here. So go wait in the waiting room, and I'll have you return when I'm ready to have you be back in here with us to work on this, and trying to set some sort of a boundary or a limit. I talked with his parents. He came back in, and he was better when he came back in, and did actually try to repair a bit, which was good. That was about 3 sessions ago. The last session, which was this past week, he was much kinder to his mother, saying how certain situations, what it felt like for him, and in terms of level of agitation. He did even talk about the emotion he experienced, which was good. And I pointed out to him, you did such a great job today. I know this is hard for you, but you really took the time to stop and think about what was happening for you, and you didn't make us guess. You told us. And did you see how we were able to make an adjustment when we stopped guessing and we knew exactly what was happening for you? And I think it was helpful that we let you know exactly what was happening for us. And he said, yes. And so then I said, you really did a great job today. I'm so impressed. And he looked at me and he said, well, I have been coming to counseling for about 3 months now. Which is he can be really kind and sweet in that way. And he got a big chuckle out of that too. But that's good progress, right? And it's not putting a behavioral system in place. It's not figuring out what the right consequence is for the misbehavior. It's building the sense of you impact other people, you have experiences and feelings, and it's okay to let people know what they are. Nothing bad is going to happen if you do that. But he was so concerned about letting out what was happening internally for him. We still haven't figured out why that is, which I would like to figure out, but we can make progress without knowing the direct cause of it. I think he had some difficult interactions with peers that has led to him being guarded, not with his parents. But then I think there's this underlying piece of his parents didn't know that this happened with peers, and why didn't they know that it was happening, and why didn't they protect them? So there was this punishment of being dismissive of them. On his part, this is how he was getting back at them for the disappointment. But this is going to take some months to work through. Questions about that? Or questions about, so how is this mentalization-based counseling? Is this making some semblance of sense? Okay. All right. Okay. The next part, and we covered this a little bit with the case here, but the next part that we want to, when we are in the here and now, and we're not talking about extraneous things or things that we can't control, and then in the here and now, as we're talking about situations, we want to talk with people, young people or adults, we want to talk to them about, so what do you say to yourself when you're emotionally overwhelmed? when you're cutting class, what are you saying to yourself? When you're getting to the point where you're throwing chairs, what do you say to yourself? Now, you can't do that in the crisis moment, right? So, like 2 minutes after the chairs are stopped being thrown is not the time to have this discussion. I got hit with a chair for the first time about 2 months ago. That means I'm getting old. I couldn't dodge the chair fast enough. I was so disappointed in myself. It was a fourth grader. It wasn't a 5-year-old. There was a little velocity on the chair, but it's getting so much more intense. So the thing we want children to start to be able to reflect on is these automatic thoughts and responses that are, or not responses, these automatic thoughts which are a response to situations they face. And what those internal dialogues are like. Based on what we've learned this morning and today, why is it important to work with the child to start accessing these internal dialogues that they're having? Think about some of the basic principles. Well, I guess the first question should be, is it important to help the children analyze their automatic internal dialogues? It seems, so we can agree, it seems like that's important. Okay. Well, that's good. I didn't mean that to be facetious. So, because that's, if we're going to use this approach, we have to believe that to be true. Okay. So there is some value and importance in helping children become aware of this internal dialogue. What do we think could be the benefit of that?
Begin to shift it. Like if they can't identify what it is, we can't work to change it.
Right. Okay. So if they're going to start to shift that, then we have to have a good understanding of what that is that needs to be shifted. Okay. And why do they have trouble? Oh, go ahead, Lily.
I think once you become more aware of your own internal dialogue, then you can kind of reflect it back onto others.
Yeah.
Make progress.
Yeah, and not only reflect it back onto others, but start to consider somebody else's internal dialogue, right? And again, we have to remember, if there's a significant insecure attachment, they haven't experienced anyone saying accurately to them, this is what you're feeling, this is what you're thinking, let me help you with that, right? So not to be repetitive of what we talked about this morning. So, how do we get them to start talking about their internal dialogue, or even becoming aware that they're having one? And if you think about it, God, it seems so out of place that someone doesn't have an awareness of their internal dialogue. And particularly for all of us, since we do mental health work, we probably have nearly constant internal dialogue while we're awake, right? Like, as you're sitting here now, you're having an internal dialogue that you're simultaneously aware of while also listening to this dialogue that's happening in the room, right? There may even have been a few moments today, very few, but there may have been a few moments today when you were so focused on your internal dialogue that you weren't attending to the dialogue coming from me. No. Possibly. No. Maybe it happens at a point here or there, right? That's how prominent our awareness is of internal dialogues. There may be times when you've been sitting at home or driving in the car with your spouse, and he or she has been talking to you, and the internal dialogue was so much more important to you than what your spouse was saying, right? Even in that closed little compartment of the car. That's how prominent internal dialogues are for us. And then we have these young people who have such little awareness of them, right? So it's hard to wrap our heads around, but we have to recognize that that's what happens, okay? So we have to really teach the skill of getting access to it. Sometimes we're fortunate, particularly when kids are being explosive, the internal dialogue overflows into external dialogue. So particularly with elementary age children, typically we can get, and without asking, and without, even though they're not aware that it's overflow, they'll describe something that's happening at home and how they're so frustrated with their parent who did something while they're kicking, while they're in a timeout room, kicking the door or kicking the walls or whatever. That's insightful for us to have. The other technique that I've used and that has been quite effective is to talk about kids and say, hey, that video that plays in your head? Like how sometimes you're thinking about something and it's like there's this movie, this video playing, and you can replay something that happened before, or there's this thing that's happening where you're thinking about what might happen next. You ever have that experience of those videos that are playing? And pretty much every I've never had a kid say no, right? And say, you know what? Those are really important. Those are important to tune into and for us to think about what's happening for you while those videos are playing. And so, we're going to work on learning how to do that better. Now, you describe that in a developmentally appropriate way, depending on the age of the student. Sometimes when I was working with elementary age students, I would draw like an iPad and make a YouTube logo and say okay, so this is video playing. What would be on your screen? Or if you have a real iPad, you could say, okay, pretend this is what's playing in your brain. What would be on the screen? And they can tell you. And it could be less concrete with older kids, right? And then we could start to talk to them about what happens for you when you play that video. And it could be, what do you feel internally? Do you get butterflies in your stomach? Do you start to clench your fists? Does your heart start racing? Whatever it might be. Or if they're more advanced, what kind of a mood does it put you in when that video is playing? What emotion happens for you when that video is playing? Now, this can be challenging if we begin this focused on negative moods or negative emotions, unpleasant moods or unpleasant emotions. So when starting this out, it can be helpful to say, imagine a really good day. What would be a really good day? Okay, let's play that video in your mind. You could ask them to close their eyes. Some kids don't like to close their eyes because of insecure attachment reasons. So, but if they do, you could do that, and then start to talk with them about playing that video and what happens for you and so forth. And then you could shift to at another session maybe unpleasant situation and what that video was like and what happened to them. Once you get that foundation established, then you could start shifting it into, what do you say to yourself in the classroom when this situation happens? What video plays in your head when you come to school and there's a substitute teacher, as an example? What video plays in your head when you get to school and realize you forgot to do your Spanish homework and the Spanish teacher calls you out in class when you forget to do your Spanish homework? Right, and to start to have an awareness, and then we can move to, So you have this habitual thought, and then you have a habitual response to that thought. And we need to interrupt that process from thought to response or that thought to action. Right? So this is where we're overlaying mentalization-based counseling with cognitive behavioral counseling. Okay. Does that make sense? Okay. And then that's where we can start to work with the students on making a change to the video that plays. If we can get them to agree they don't like the outcome, right, of their habitual response that follows the thought. Is that fair? Okay. The other thing that we can do as they're describing the video is we want to make sure we start helping them interpret it, which is the last bullet there. So it sounds like you don't like that story. That's the initial part. And then we move to, I can tell that you're feeling frustrated by that video. Now, here's another simple thing that you can incorporate with this to kind of extend this analogy that we're looking at with videos is if you say to a student, if you click on a YouTube video and you start watching it and you really don't like it, what do? Do you keep watching it? How many kids say yes? They keep watching it until they bring themselves into the deepest depths of misery. Right? No one does, right? What do you do if you don't like the video that you're watching on YouTube? You change it. If you can change the video on your iPad, you can also change the video that's playing in your head. It takes more effort, it takes more work, but you can change it. That's a CBT strategy, but it plays in here, right? You guys have probably used that strategy before. Okay. If we don't get children to start changing their self-talk, young people to change their self-talk, what starts to happen is that they get into rigid patterns, really rigid habitual actions, and we need to start teaching them some alternatives. And we do that with role-playing. So role-playing is pretty straightforward, but it can come into play here. I won't spend much time on this. But what role-playing does is it helps a student to see there's an alternative way to behave in this situation. That's really revolves around skill building, right? Some young people don't know that they can think about a situation differently, and they don't know that they can take a different action in a situation. But if you don't change how you're thinking about the situation, you can't change your action in the situation. So they both have to happen simultaneously. I shouldn't say you can't. It becomes really hard to change your behavior or your actions if you don't change your thoughts. So once we help people to start changing their thoughts by becoming aware that I'm having these thoughts, they're my thoughts, they're no one else's thoughts, they're in me, right? And they're valuable, and they're helping me interpret the world around me. Then, by understanding those thoughts better and changing those thoughts, I can act differently. But I don't know how to act differently because this is how I've been acting my whole life. So, okay, I can help you with that. Let's role play a different way to act. Okay. People love role playing. Sometimes we have to demonstrate it, but they really are effective with it. One thing I would suggest in your counseling sessions, if you get permission from the parent or guardian, is to video record the role plays and then show them back. And what I used to do with elementary age students is I would video them role playing the bad way or the habitual negative way. They love that. And here's the thing that you notice that it makes it clear how habitual it is. You could be in this calm, relaxing moment in your office and you say, show me what you do when whatever. And they could step right into it and be completely in it. That's how used they are to doing it, how habitual it is. They can step right into the role. And then you have them role play doing it differently, and then you show them two different things. It's really effective. And then the other thing that I do not in my work in schools, when I was working in schools, but in my work with private therapy, is I would send the positive role play as a file to home and have the parent and the child watch the positive role play repeatedly so that they could see that it's an option together, and then play it out together and watch it, together on their phone or iPad, whatever. In the olden days, when I started doing the role plays, it was on VHS tape or CDs you have to send home. It was real hard to edit. It was really time consuming, but it was incredibly effective. Okay, let's see here. Okay, we'll skip that. Okay, and so there's some complexity here. It's not, like I said before, it's not a cookbook or linear process. These are some of the techniques that could go along with this type of approach. I'll send you some references if you want to read more about it. The other thing I could offer to you is, if you're working on a case and you want to try this approach and you want to get some feedback from me, just email me or give me a call and we could talk about it. On a bigger scale, if you wanted to do some training in your district around this with more people or get more people on board, we could set that up too. But I'd be happy to chat with you about a case and try to run through some of this, because it does take some getting used to.